Okay, so about the bone, pelvic ataupun nama lain hip bone ataupun coxal bone. So composed of 3 bones, which are the ilium, okay, the pubis bone, and also the ischium bone. Okay, 3 bones forming the coxal bones. So it's fused already, right? You nampak separated during childhood because it's not fused yet in the acetabulum. This is in adult, it's fused already. So you can see in the acetabulum it's fused. It's difficult to appreciate kalau dah adult live in X-ray, memang we cannot see lah the demarcation. Okay, in children you can see. Okay, so you can see the acetabulum. So the pubis, this is ischium, and this is the ilium. Okay, so about 1/5 of the pubis forming the acetabulum, about 2/5 of the acetabulum formed by the ischium, and the remainder about 2/5 also of the acetabulum is formed by the ilium. Okay, so it's act as a socket to the femur bone forming hip joint. You dah familiar femur bone during the MSK. Okay, so this is the bones of the pelvic girdle. Okay, obturator foramens. This is area of the pubic bone, obturator foramen. Okay, superior pubic ramus, inferior pubic ramus. Okay, pubic symphysis, pubic tubercle. Pubic tubercle always lateral to the pubic symphysis. Yang in the middle is the pubic symphysis. Okay, the ilium, iliac crest. This is the iliac crest. Okay, anterior superior iliac spine, anterior inferior iliac spine. Okay, greater sciatic notch here. Iliac fossa somewhere here. This is iliac fossa. Okay, lateral sciatic notch. Okay, so this is the lateral view. This is the pubic body. Okay, this is the body. This is the pubic crest. Okay, so this is the pubic symphysis. This is still in the pubic part of the pelvic. This is the pubic crest. This is pubic symphysis, pubic crest, and pubic tubercle. Okay, so in the middle is the pubic symphysis. Lateral to it, the pubic crest, dia macam ada flat, like bonjolan, tapi dia macam banyak dan yang ni satu je bonjolan, we call it pubic tubercle, which is the most lateral. Okay, pubic symphysis, pubic crest, and pubic tubercle. Okay, this is the lateral view. Ischial ramus, this is ischium bone, ischial ramus. Okay, ischial tuberosity, I think where the area of you sitting now, you sit on your ischial tuberosity. Okay, ischial spine. Okay, sorry, this is the anterior, this is the posterior. Okay, this is the lateral view of the right hip bone. Okay, this is the ischial spine. Okay, okay, ischial spine, ischial tuberosity, and ischial ramus. Okay, now I just want to concentrate on the ligament. Okay, sacrospinous ligament attached from the sacrum to the spinous to the ischial spine. Sacrotuberous ligament from the sacrum to the ischial tuberosity. And this is the foramen. Once there is ligament, so daripada nama notch become the foramen. Jadi greater sciatic notch. So once there's a ligament there, so we call it greater sciatic foramen. Okay, and also this one, lesser sciatic foramen, because of the presence of this ligament. Okay, so this is the anatomical position of the pelvis. How are you going to hold the pelvis? If we ask you to hold in the anatomical position, okay, you have to identify first the axis or anterior superior iliac spine and the pubic tubercle. Okay, it should be in the same line. What line is the vertical line, not horizontal line. So hold like this. You have to identify the axis, both axis, as well as the pubic tubercle. It should be in the same line. Same line, which the line should be vertical. Okay, about the joint now. Talk about the joints. Sacroiliac joint. This is sacroiliac joint, the strongest joint in the body. Our sacroiliac joint is the strongest joint in the body. The syndesmotic and synovial parts. Okay. Then pubic symphysis, secondary cartilaginous joint. Okay. Anda faham kenapa turutan jadi macam tu? Dia punya PDF macam mana? 3-4. Okay. So lumbosacral joint, this is a lumbo between the lumbar and also the sacrum. The symphysis and synovial type of joint, and sacrococcygeal joint, so symphysis and synovial type of joint. Okay, this joint. Alright, so the pelvic rim. Now I'm talking about the pelvic inlet. What are the demarcation, bony demarcation that forming the pelvic inlet? Okay, first, from the posterior is a promontory of the sacrum. This is the promontory of the sacrum. Yang maksudnya yang paling bonjolan area of the sacrum. Okay, that's promontory of the sacrum. And then linea terminalis. Linea terminalis formed by the arcuate line, pecten pubis, and also the pubic crest. And last but not least, the upper part of the pubic symphysis. These are the bony structure forming the pelvic rim. Okay, a bit of the pelvimetry of the inlet. Especially for during your gynecology or ONG posting later, this is the measurement, okay, done after the X-rays of the pelvis of the mother, because you want to know whether this mother is suitable or not for the vaginal delivery. Okay, so now this is the inlet. Okay, so setiap dia ada epidiameter, transverse diameter, and oblique diameter. Merah, biru, dan hijau. Okay, so the epidiameter is the nama lainnya is a true conjugate. The next slide I explain pasal true conjugate. Okay, the epidiameter of the inlet. This is inlet, not mid pelvis or not outlet. We're still talking about the inlet. Okay, inlet ada 3 diameter, epi, transverse, and oblique. The epi between the midpoint of the sacral promontory. Okay, midpoint ni tengah-tengah ni lah. Sacral promontory kan dari sini sampai sini, so in the middle, and upper border of pubic symphysis. Okay, so this is the measurement, right? And transverse diameter, just maximum that distance between similar point. Okay, so maksudnya apa-apa point yang paling besar lah, paling point tu kena similar left and right, but the widest diameter. Okay, and about you can see about 15.1 in the adult female. And oblique diameter from the iliopubic ramus and to the opposite sacroiliac joints. Okay, about 12.5 cm in adult female. Okay, so this is the conjugate. This is the other type of measurement. We call it conjugate. Tadi diameter is conjugate. There are 3 types of conjugate: anatomical conjugate, obstetrical conjugate, and diagonal conjugate. Okay, so tadi anatomical conjugate is a true conjugate of the pelvic inlet, okay, which is the epidiameter. That is a true conjugate or anatomical conjugate. Obstetrical conjugate here, indirect way of the true conjugate is estimation. It's just the somehow it's difficult to measure. We need might be the X-ray as well. Okay, the shortest epidiameter, about 10.5 cm. From nearest point of the posterior surface of the pubic symphysis to the sacral promontory. Okay, sekarang ni obstetrical conjugate dia pakai pula at the posterior surface of the pubic symphysis. Okay, and this is the diagonal conjugate. This you can measure manually. Okay, by the VE, vaginal examination. Okay, is from the inferior margin of the pubic symphysis to the sacral promontory, about 12 cm. This is the sagittal section of the pelvic view. Okay, again, this is true conjugate epidiameter of the inlet or brim. Okay, and this is obstetrical conjugate, the least diameter. And then also this is the diagonal conjugate. You can measure during the vaginal examination. You put the finger and inside there and go to the sacral promontory. So when the gynecologist using your finger to measure the vaginal examination, it measure the diagonal conjugate diameter. So now pelvic cavity, tadi inlet, okay. Now pelvic cavity, okay, is a short curve mark longer posterior wall. Posterior wall longer as compared to the anterior wall. And pelvic cavity diameters are measured at approximately at the mid level. Maksudnya tengah-tengah ni lah, at the mid level. This is the diameter of the how to measure the diameter of the pelvic cavity. Just take any of the measurement of the mid level. Okay, so it's bounded anteriorly by the pubic bone, pubic rami, okay, pubic rami, and also the pubic symphysis. This is the anterior boundary, posterior boundary sacrum and coccyx, and laterally by the fused ilium and ischium. Ilium and ischium. This is the lateral boundaries of the pelvic cavity. Okay, now how to measure the diameter or pelvimetry of pelvic cavity? The epidiameter between the midpoint of the third sacrum and up to the posterior surface of pubic symphysis. Okay. For the transverse diameter, any widest transverse distance between side wall of the cavity, the wall, side of the wall, in the middle part. Okay, just measure any widest transverse distance. It should be same left and right. And the oblique diameter from the lowest point of the SI joint to the midpoint of the contralateral of the obturator membrane. Okay, these are the measurements of the cavity. Okay, now we go to the outlet. This is the inferior view. Tengok dari bawah. Okay, coccyx and pubic symphysis. It's a diamond shape of the pelvic outlet. Nama lain of the pelvic outlet is the inferior pelvic aperture. This is the other name of the pelvic outlet. Okay, so what are the boundaries? Posteriorly by the tip of coccyx. Okay, laterally, bilaterally by the ischial tuberosity, and then pubic arch. Yeah, this is the pubic arch. Anteriorly. Its floor is from the floor of the pelvic cavity by attachment of the pelvic diaphragm. Okay, so pelvic outlet ni adalah there's presence of the pelvic diaphragm. Okay, so pelvic diaphragm is located at the pelvic outlet, and this diaphragm forming the floor of the pelvic cavity as well. Okay, outlet, floor, diaphragm, semua dekat tempat yang sama. Okay. So this is about the pelvimetry. Epidiameter from the apex of the coccyx, okay, to the midpoint of the lower rim of the pubic symphysis. Lower rim pubic symphysis. Transverse diameter between the ischial tuberosity and the lower border of the medial surface. Okay, I think this is the ischial spine, or you can use also the ischial spine or ischial tuberosity. And then oblique diameter or midpoint of the sacrotuberous ligament on the side to contralateral of the ischiopubic junction. Okay. So these are the other planes as well to measure. Plane of the greatest diameter is the anteriorly at middle parts of the pubic symphysis and posteriorly at the second and third sacral segment, almost like the AP of the pelvic cavity, this plane of the greatest diameter. And plane of the least diameter, okay, between the apex of the ischial spine, about, okay, this one, least diameter, about 9.5 cm in adult female. So there's a lot of measurement, conjugates lah, okay, diameter and the other planes as well. Alright. So this is about the axis. The course taken by the presenting part of the fetus as it passes through the pelvis, okay, that is the pelvic axis. Okay. So at first it's moved downward, okay, and backward, okay, downward and backward to the level of the ischial spine. We call it axis of inlet. And then here the direction changes and presenting part proceed downward and forward. This is axis of vagina here. So this is the axis of inlet and this is the axis of vagina. That's how the presenting fetus head. Okay, this is the axis of the birth canal. Dari atas, okay, and then this is dekat tengah and finally here. Okay, so it's fat. First with the transverse. Okay, this is the occipital. This is the occipital. This is the frontal, occipital bone. This is the frontal part of the fetal head. Okay, the transverse macam ni. And then subsequently, Occipito anterior. This is occipito forward left anterior. Okay, kat sini. And then finally, the occipito at the anterior. We call it occipito anterior. So this is occipito at the anterior part of the pelvis. So the baby is always facing towards the mother's anus. Okay, that's how the presenting fetus, the position from transverse, left occipito anterior, and finally occipito anterior. Okay, this is how the variations of the pelvic bone. Kita tengok dekat inlet dia. This is the classification at the inlet, bukan mid pelvis or outlet. Okay, so this is a typical 4 typical features of pelvic bone that present worldwide. Gynecoid or round, okay, android, wedge, platypelloid, oval, and anthropoid, oval long. Okay, this is 4 types of the pelvic inlet that present. Okay, so these 4: gynecoid, android, anthropoid, and platypelloid. So this is the inlet features, this is the mid pelvis features, and this is the pelvic outlet features. Okay, for the inlet, okay, the gynecoid is oval in transverse axis, slightly oval. Android, okay, is heart shape with anterior narrow apex. Anthropoid oval in epiaxis, and platypelloid oval in transverse axis. Okay, this is the mid pelvis features. You can see in the gynecoid, the cavity is very shallow. Okay, so it's good for delivery, shallow. And the ischial spine is blunt. Sacroischiatic notch wide. Okay, sacrum also broad and well curved. Now you have to compare with the android. Okay, the sacrum curved, ischial spine very projecting, difficult to passage of the fetus. Okay, cavity very funnel shaped and very deep. Okay, and outlet subpubic arch. Okay, below the pubic symphysis too. Okay, this is very wide. Okay, and this is narrow. Okay, so this is ideal for vaginal delivery with good prognosis in gynecoid features of the pelvic bone. And this is poor prognosis. Okay, and this is also the poor prognosis. Okay. So this is the common, usually the gynecoid for female and android for male pelvic bone. Okay. Still about the gender differences. Okay, bone more thicker, the false pelvis deep, male, the cavity narrow and deep. What I mentioned just now, the inlet heart shape compared to female, round shape. The outlet is small and large for the female. The pubic arch, okay, and about 50 to 60 degree and rounded about 85 degree. The obturator foramen ovoid and for female is triangular. Acetabulum large as compared to small in female. Okay, the ischial spine points medially in male, so difficult to passage of the baby. Okay, this sacrum, okay, pronounced, the curvature is very pronounced in male. The coccyx point anteriorly, however in female the coccyx points inferiorly, so allow the passage of the fetus. The deep iliac fossa, shallow iliac fossa in female, and greater sciatic notch is narrow in male. Okay, so this is greater sciatic notch. This is male about 50 degree and female about 75 degree. Okay, length of the iliopubic ramus. This is the iliopubic ramus, and diameter of acetabulum is almost the same in male. Okay, however, in female, the length of the iliopubic ramus is a bit longer than the diameter of the acetabulum. Okay, this is another class. How the difference between male and female pelvic bone. Okay, we go to the lesser pelvis. You can see this is the lesser pelvis here. Okay, this is the anterior wall formed by the bodies and rami of the pubic bone. Okay, and also the pubic symphysis. And then posterior wall, sacrum and coccyx. This is sacrum and this is coccyx. The piriformis muscle, okay, forming the posterior wall also, and all the ligaments, anterior sacroiliac ligament, sacrospinous ligament, and sacrotuberous ligament. And they are forming the posterior wall of the true pelvis. Okay, this is about pelvis muscle, piriformis muscle. Pass out the pelvis to the greater sciatic foramen, superior to the sacrospinous ligament. Kita nampak ni. Superior to the sacrospinous ligament. This is anterior view, innervated by the anterior rami of S1 and S2. Okay, this is forming the posterior wall of the true pelvis. Lateral wall to lateral wall, forming this is the structure forming the lateral wall. Yang paling penting is the obturator internus muscle with its fascia. Okay, that is the most important structure forming the lateral wall of the true pelvis. Okay, and the floor of the true pelvis I mentioned just now is we call it pelvic diaphragm. Okay, it's located at the pelvic outlet. It's forming the true pelvis floor. Okay, so it across this full pelvis floor, across the pelvic outlet, separated the pelvis. Okay, inferior to pelvis is the perineum. Okay, so it separate the pelvis and perineum function. Pelvic floor form the muscular sling to support all the abdominal pelvic viscera. Okay, resist increase in intra-abdominal pressure, help to hold pelvic viscera in position. Okay, shape of pelvic diaphragms help to direct the fetal head into IT diameter of the pelvic outlet. Okay, so these are the pelvic diaphragm that forming the pelvic floor. So, what are the pelvic diaphragms muscles? Okay, first is levator-ani muscle. Okay, this is the levator-ani muscle, and second one is the coccygeus muscle, or nama lain some of the book called ischio-coccygeus. Ischio-coccygeus and coccygeus. So the coccygeus and levator-ani muscle forming the pelvic diaphragm. Okay, so pelvic diaphragm is located at the pelvic outlet, forming the pelvic floor. Okay, jangan confuse dia lebih kurang sama dia terms ni. Levator-ani, okay, semua ni is a broad. The boundaries cannot easily be distinguished in the human or cadaver. Susah nak differentiate between all the sub muscles. Its origin at the body of the pubis. Okay, cutaneous arch of the obturator fascia tepi tadi, and also the ischial spine kat bawah. It divided into three: pubio-analis or pubio-rectalis, pubio-coccygeus, okay, as well as the ilio-coccygeus. Okay, pubio-coccygeus ada dua, either pubio-vaginalis or pubio-prostheticus. Okay, and then ilio-coccygeus. So these are the muscle forming the levator-ani and innervated by the ventral rami, which is the pudendal nerve. Okay, there is coccygeus muscle also innervated by the pudendal nerve. Okay, pubio-rectalis. This is the pubio-rectalis. Is a thicker muscle form U-shaped muscular ring, or nama lainnya pubio-rectal sling. Okay, this is the pubio-rectalis muscle that passes anterior to the anorectal junction. Anterior to the anorectal junction. Okay, anterior to it. So, major role in containing fecal continence. Dia boleh tahan dia punya feces by this muscle pubio-rectalis. It will hold the fecal. Okay, so bit of the applied anatomy. So, tear of the pubio-coccygeus muscle during vaginal delivery. Okay, so it can cause urinary incontinence, characterized by the dribbling of urine when you're coughing or lifting heavy object, and as well it can prolapse the pelvic organ if not untreated well. Okay, this is what happens if the tear of the pubio-coccygeus muscle in vaginal delivery. A bit of the pelvic fascia is a connective tissue that occupies the space between membranous peritoneum and muscular pelvic walls. The pelvic fascia of the pelvic continues with the fascia lining the abdominal wall above and fascia of the perineum below. But two parts of the pelvic fascia, parietal pelvic fascia here, okay, yang warna merah ni, yang already cover the muscle and organs, and also this is parietal and also the visceral. Okay, parietal and visceral pelvic fascia. Okay, the parietal pelvic fascia, hijau ni, so covers the muscle of pelvic wall and the floor continuation of the transverse fascia of the abdominal wall. Okay, I hope you still remember the transverse fascia of the abdominal wall. So these are the example of the parietal pelvic fascia, parietal fascia, piriformis fascia, superior fascia of the pelvic diaphragm and the presacral fascia. Then the visceral fascia here covers the pelvic organs and their neurovascular supply. Okay. Lateral attachment of the pelvic organ to the pelvic side wall are endopelvic fascia. So this is the endopelvic fascia. Okay, yang cover organ tu adalah visceral pelvic. Yang covering muscles, most of the muscle are parietal pelvic fascia. Okay, so a bit of the neurovascular structure in the lesser pelvis. Okay, we start with the artery. Okay, this is the common, the important artery in pelvis and perineum started from the common iliac artery. Okay, so this is the branches, the branch of the common iliac artery. Okay, left and right, left and right common iliac artery at the L4. Okay. Right lebih panjang, about 5 cm as compared to the left common iliac artery, about 4 cm. Okay, so these arteries, right and left common iliac artery, descend and divide at the S1 level into the external iliac artery and internal iliac artery. So ada dua, right and left. Right internal iliac artery and right external, sama, left internal and left external iliac artery at S1. Jadi common iliac artery at L4. Now at the S1 they divide into two. Okay, external iliac artery, principal artery of lower limb, we learn at the MSK, and internal iliac artery, right and left internal artery, provide the principal supply to the wall and viscera of the pelvis, perineum and gluteal region. This artery is important during the reproductive system. Okay, now we go to the internal iliac artery. Okay, this is common iliac artery, this is internal, and this is internal. Okay, internal iliac artery here, 4 cm long origin is a common iliac artery, bifurcate at the level L5, S1 ataupun S1 joint, descend posteriorly, not anteriorly, posteriorly, to superior margin of the greater sciatic foramen. This is the greater sciatic foramen, dekat in front of the superior margin of the greater sciatic foramen, and divide, and now is further divided into two, anterior division and posterior division. Yang hijau ni anterior division, belakang ni yang biru ni posterior division, ada dot. So anterior division, which continues in the same line toward the ischial spine, same line toward the ischial spine ke bawah macam ni, supply the pelvic organ. Posterior division pass back to the greater sciatic foramen, supply muscle of the hip and back. Okay. So common iliac artery, and then internal and external. Okay, now at internal ada anterior division and as well as the posterior division. Okay. They divide at the area of the greater sciatic foramen, yang anterior and posterior division. Okay, about the relations, you see now, internal, this is the internal iliac artery. Okay, common iliac artery, this is external iliac artery. Okay, the posterior relation is the internal iliac vein here. The anterior relation, ureter, or ureter for both gender, male and female. Kalau kat male ada uterine tube and also the ovary. Yes, the anterior relation of the internal iliac artery. Lateral relation here, external iliac vein and obturator nerve. Okay. And medial relation is perineum, which separate from the some part of the gut. That is the medial relation of the internal iliac artery. Okay, now
sama tingkat dengan DK1.
anterior divisions of the internal iliac artery. This is the arteries that are important during the reproductive system. Okay, This is some mnemonics. Orange under some eyes might feel instantly. Tapi yang ni I buat susunan dari atas ke bawah. So orange is obturator artery, okay, under uterine artery or uterine artery and umbilical artery. S is the superior vesical artery. Is the inferior gluteal artery. M medial rectal artery. P is a pudendal, which is internal pudendal. I might be the inferior vesical artery. Okay. So this is the artery, anterior division. Okay, superior vesical artery here. Okay, there. This one superior vesical artery, and it become superior vesical artery and also the umbilical artery, sekali. And then this obturator artery, inferior vesical artery in male, but in female there's no inferior vesical artery. Okay, there's vaginal artery. And uterine artery here in female, however, sometimes uterine artery also can branch from the vaginal artery here. So it might be present or absent, uterine artery in female. Okay, then internal pudendal artery here. Medial rectal artery first, internal pudendal artery, and inferior gluteal artery. These are all the branches of the anterior division of the internal iliac artery. Okay. Now posterior division ada 3 saja, sikit je. Yang naik ke atas adalah iliolumbar artery, okay, lateral sacral artery here, and also the superior gluteal artery. Only 3. Okay, superior vesical artery. This one, first large branch of the anterior division, and it gives origin of the umbilical artery in fetus, but it remains becoming the ligament in adult. We call it medial umbilical ligament, not median, not lateral. Okay, dia ada median, ada medial, ada lateral, but it's become the medial umbilical ligament, left and right. Okay, so that is only umbilical artery, but the superior vesical artery is still functioning in adult. Okay, so this is the area of supply, ureter, bladder, vas deferens, and seminal glands. Okay, then obturator artery here. Okay, obturator artery runs anteroinferiorly on the lateral pelvic wall to the upper part of the obturator foramen. This is the obturator foramen. Laterally related with the obturator fascia, crossed medially by the ureter, vas deferens in male or ovary in female. Okay, and pass between the obturator vein and nerve. Alright, so this is the area of the supply of the obturator artery. Okay, so this is obturator canal in the obturator foramen. Bila ada obturator membrane, ada satu part kecil tu we call obturator canal. Lift pelvis via obturator canal and divide into anterior and posterior branch. Okay, so it encircle the obturator foramen between the obturator expernus and obturator membrane, and they anastomose each other. So the obturator artery, there are the branches as well, which is the anterior and posterior branches. Okay. Inferior vesical artery give rise to the artery to vas and prostatic branches. Okay. Vaginal artery, okay, so it's homolog into the inferior vesical artery in male. Yeah, I mentioned just now, can arise from the uterine artery. Numerous branches supplying anterior and posterior part of the vagina. Okay, so this is the uterine artery, usually large, homologous to artery to vas. Descend on the lateral wall of the pelvis, running inframedially in the cardinal ligament. Pass medially to the junction between uterus and vagina, supply to the ureter. So these are the branches, ascending branches. Okay, these ascending branches, ovarian and tubal branches, and also the vaginal branches. Okay, and you can see the part yang tortuous, okay, only at the ascending branch. Okay, the other part macam vaginal branch, ovarian branch, and tubal branch is not tortuous. Okay, so you kena ingat yang the tortuous part of the uterine artery is at the ascending branch yang dekat dengan uterus saja. Okay. So this is the medial rectal artery. Medial rectal artery here. Descend to the inferior part of the rectum. Here supply the inferior part of the rectum as seminal glands, prostate gland and vagina. Okay, internal pudendal artery. This is only the pelvic portion. In the perineum portion, I will explain later. Okay, so this is the internal pudendal artery here. Ini pandangan dari belakang. This posterior, this anterior, tapi dia sengit sikit. Okay, this is left pelvic part. Pass infero-laterally anterior to the piriformis muscle. Okay, anterior to the piriformis muscle. Inferior gluteal artery and sacral plexus. Lift pelvis by passing through inferior part of the greater sciatic foramen. Okay, dia keluar pelvis kat sini. Lift the pelvis by passing through inferior part of the greater sciatic. This is greater sciatic foramen. And then enter the gluteal region, masuk ke bahagian gluteal, and then curve around posterior aspect of ischial spine. Okay, this is ischial spine. Then curve around and masuk semula dekat lesser sciatic foramen. Okay, so dia keluar kat greater sciatic foramen, pergi ke belakang bahagian gluteal, hook around the ischial spine, masuk balik dekat melalui lesser sciatic foramen, and dia akan masuk dekat ischio-anal fossa later in the perineum. I will explain further. Okay, this is special about the internal pudendal artery. Dia keluar, dia hook, dia masuk balik. Okay. So pass through the pudendal canal. This is the pudendal canal. Nama lain Alcock's canal. Together with the vein and nerve. Okay, exit the canal medial to the ischial tuberosity, and it divides into three terminal branches: inferior rectal artery, perineal artery, and also dorsal artery of penis and clitoris. Okay, so these are the cause of the internal pudendal artery, and its branch inside the pudendal canal. Okay, inferior gluteal artery. Okay, pass posteriorly between sacral plexus piriformis and internal pudendal artery. Lift pelvis also through the greater sciatic foramen. Okay, and dia tak masuk balik, and dia supply all this muscle. Okay, iliolumbar artery. Now at the posterior division, of the internal iliac artery, iliolumbar artery. First branch of the posterior division, dia the only artery yang naik balik ke atas, ascend supralaterally to the iliac fossa, lie posterior to the external iliac artery, and these are the branches. Ada dua branch, iliac branch and also the lumbar branch. Okay, so the iliac branch supply the iliacus, lumbar branch supply the psoas region. Got two branch of the iliolumbar artery. Lateral sacral artery here usually is double, maksudnya dia sekali dua. Okay, dia sekali dua, that's what is meant by double. Tapi kalau single, dia ada dua branch, satu superior branch and another one superior branch and the inferior branch macam ni. Okay, so it's descend infromedially along posterior pelvic wall, supply the sacral canal, skin, muscle and muscle posterior to the sacrum. Okay, I think last but not least, the artery is the superior gluteal artery, largest branch of the internal iliac artery. Okay, largest branch of the internal iliac artery, which is belong to the posterior division. Main continuation of its posterior division and pass between the lumbosacral trunk and anterior ramus of S1. It is also exit pelvic via greater sciatic foramen superior to the piriformis, and it has two branches. Okay, superficial branch and deep branch. Okay, superficial branch of the artery supply gluteus maximus. The deep branch supply the superior and inferior branch as well. Supply the gluteus medius and minimus. Okay, sorry, superficial and deep. Deep ada superior and inferior. Okay, that is the superior gluteal artery. Okay, I think this is just overview. External iliac artery, larger than internal iliac artery. Okay, this is external iliac artery. Descend along medial border of the psoas. This is psoas major. Along medial border to point midway between the ascis and pubic surfaces. Okay, ascis and pubic surfaces kat sini. Enters the thigh posterior to the enter the thigh posterior to the inguinal ligament. This inguinal ligament, and it's become the femoral artery. Okay, the external iliac artery becoming the femoral artery after descent on the inguinal ligament. This is just a recap during the MSK last time. Okay, tak apalah dah belajar kan during MSK yang elementary kan. Okay, so this is about the minor arteries. So there's minor arteries, gonadal artery, which is ovarian or testis, tak tunjuk sini Dia branch from the gonadal artery. It's branch direct from the aorta. This is a median or middle sacral artery here, and also the superior rectal artery. Okay, it's a branch from the inferior mesenteric artery. Okay, the gonadal artery arise straight away from the abdominal aorta, is inferior to the renal artery. Inferior to the renal artery, and descend into lesser pelvis by crossing pelvic rim and origin of the external iliac artery. Runs immediately dividing into ovarian branch and tubal branch that supply the female, and testicular artery enter the scrotum via inguinal canal, therefore does not actually enter the pelvis. Okay, because the scrotum is outside the pelvis. So this is the gonadal artery. Okay, median sacral artery, small, is unpaired, and arrive from the posterior surface of abdominal aorta. Okay, descend close to midline, and then this is the area of the supply. Superior rectal artery, continuation of the inferior mesenteric artery. Okay, it crosses common iliac vessel and descend in the sigmoid mesocolon into lesser pelvis. Okay, tak apa, I think we dah belajar during the rectum lecture. Okay, now common iliac vein formed by union of the external iliac vein and internal iliac vein at the SI joint. Okay, and left and right shorter as compared to left, combined to at L5 to become the IVC. Okay, these are the tributaries of the common iliac veins. The ilio-lumbar, lateral sacral vein, and median sacral vein. Okay, internal iliac vein. This is the internal iliac vein, formed near the greater sciatic foramen, ascend anterior to the SI joint before combining with external iliac vein. Okay, this is the tributaries of the internal iliac vein. Dalam view 1, 2, 3 kan? Terus sampai 7. Okay. So these are the tributaries of the internal iliac vein. You can see uterine or vaginal vein as well, vesical vein, middle rectal vein, and lateral sacral vein. Okay. External iliac vein, it's just a continuation of femoral vein. Okay, I believe you dah expert during the MSK, tak apa SK lah. Okay, so these are the common lymph nodes that present in the pelvis, which are common iliac and orange ni. Okay, common iliac lymph node, internal iliac warna hijau, and kuning external iliac lymph nodes. These are the 3 group of lymph nodes important in the pelvic area. Okay, so the nerve that supply the pelvis, the lumbosacral trunk. Okay, the sacral of and coccygeal plexus, and sympathetic and parasympathetic. Sympathetic. Okay, this shows sympathetic is lumbosacral trunks. Okay, lumbosacral trunks. Okay. Lumbosacral trunk is a union of the descending L4 and L5 at the pelvic ring, and then this joint, the first sacral plexus also join. That's why we call it lumbosacral trunk. The greater part of the second and third sacral rami converge on inframedial lumbosacral trunk in greater sciatic foramen, and is formed the sciatic nerve. So the sciatic nerve is from formed by the L4, L5, S1, S2, and S3. That's how the formation of the sciatic nerve. So again, the sacral plexus is located at the posterior wall of the lesser pelvis. Fibers of the dorsal division will go on to form common fibular nerve, and fibers of the ventral division to form the tibial nerve. Okay. And pudendal nerve. This is the pudendal nerve. Alright, yang warna kuning ni, kecil ni. Form just above superior border of sacrotuberous ligament. Form kat atas ni. Leave pelvis through the greater sciatic foramen. Okay. Hook around the ischial spine as well. And enters the perineum through lesser sciatic foramen. So dia macam internal pudendal artery. So the pudendal nerve ni sama, dia keluar kat greater sciatic foramen. Dia hook around the ischial spine and also masuk balik through the lesser sciatic foramen into the pudendal canal. Okay. The peak of the pudendal nerve block during vaginal delivery, we can give the local anesthetic to that area to reduce the pain during the delivery. How? You have to identify the ischial spine first. Identify the ischial spine during the vaginal examination, and usually just inject that. We believe that the nerve is located near there. So the agent, the local anesthetic agent, will infiltrate into the pudendal nerve. So it will become blocked. Okay, this is the coccygeal plexus formed by anterior rami of S4, S5, and C1. Lies on the pelvic surface of the coccygeus muscle. It supplies the coccygeus muscle, part of the levator-ani and sacrococcygeal joint. Okay, so this is the coccygeal plexus. Is formed by tadi lumbosacral plexus. Now coccygeal plexus is formed by the S4, S5, and C1. Okay. So bit of the autonomic nerve, their central sympathetic trunk, periatrial plexus, hypoglossal plexus, and pelvic splenic nerve. Pelvic splenic nerve. Okay, all the sympathetic trunk. Okay, hypoglossal plexus. Okay, this is all the plexus. Alright. Hypoglossal plexus receives sympathetic fibers via lumbar splenic nerve and parasympathetic fibers via the pelvic splenic nerve. Okay, so the mix autonomic, which is the hypoglossal plexus. They are the mix sympathetic and parasympathetic. Ingat hypoglossal plexus, the mixed component, sympathetic and parasympathetic component. Okay, so these are all the structures that present, that go through above piriformis muscle, lower piriformis muscle. Okay, so above piriformis muscle, piriformis akan lalu dekat greater ke lesser sciatic notch? Greater sciatic notch. Piriformis akan lalu dekat dalam greater sciatic notch. Above the piriformis muscle are the superior gluteal artery and nerve. Okay, below dia inferior gluteal artery and nerve, pudendal nerve, internal pudendal artery, and nerve to the obturator internus. Okay, as well as the sciatic nerve and as well as the sciatic nerve. Tapi yang masuk balik dekat lesser sciatic foramen is the pudendal nerve and internal pudendal artery. Okay, yang tu yang akan masuk balik dekat lesser sciatic foramen. Alright, so I think that's it for the first half ni. Okay, so you all tak ada apa-apa kan? I mean pukul 11.30 until 12.30 ada apa-apa 12.30 to 1 ada apa-apa? Tak ada, okay. I'm not sure bila my presentation will be finished. So if let's say it's finished at 11.15 ke, we start at that time, is okay? Okay? If let's say this extend until 11.30 now, then I have to start at 11:30 lah. I'm not sure in the schedule is 11:20. Okay, so tak apalah, saya duduk sini lah untuk present. Tak apa kan, tak kacau you all kan?
Tak.
So we start again after my presentation finish ya. Okay, thank you very much. Anything you can ask me here?
Presentation apa?
Tak ada presentation.
Online.
Online.
Menarik je. Tapi bising tu.